Well, hi, Eric, and welcome to Rebuilding My Health Radio. I am grateful to have you here today to talk about your personal health success story and your wisdom as a practitioner.
Well, thank you so much for having me, Casey. I'm really excited to have this conversation.
Yeah, me too. I'm looking forward to it. So, today we're talking about how you treated your Graves' disease naturally. So, let's kind of go back in time to the onset of Graves, your symptoms, and what you experienced.
Sure. So I don't know if you want the entire story because I mean it started out I was intentionally exercising and dieting and detoxifying, trying to lose weight because I was a little bit overweight at the time. And I was successful in losing weight. Little did I know that some of that weight loss eventually was due to the hyperthyroidism, which is one of the classic symptoms. And I really didn't know for sure until one day I was walking around a retail store and they have those automated blood pressure machines. And I took my blood pressure, which was normal, but my resting heart rate was elevated. It was 90, which for me is high. And then next few days I would just take it manually and it was anywhere between 90 and 110 beats per minute. And so that's when I knew something was wrong. I still wasn't sure as far as what it was. I mean, I had some experience, not personal experience with thyroid, but going through some of my continuing education credits and some thyroid seminars. But went to a primary care doctor, and sure enough, he did some basic blood tests at the time, diagnosed me with hyperthyroidism. And then a few months later, I saw an endocrinologist, and she did some additional testing, specifically the antibodies, which confirmed that I had Graves' disease. And that, in a nutshell, is how I was diagnosed with initially hyperthyroidism and eventually, and then Graves' disease.
Interesting. And you did have a family history, is that correct?
No,
Oh,
actually,
you
no,
did
no,
not.
no family history of
Okay.
Graves. My mother had hypothyroidism many years ago, and this was really before they tested antibodies. So this was like 30, 40 years prior.
Mhm.
Uh, uh, yeah, when I was a child. And so we have no idea if she had Hashimoto's or not. She didn't take any thyroid hormone. So yeah, no, other than that, no family history of any thyroid conditions that I'm aware of.
Right. Yeah. And so kind of it felt like it came out of nowhere, probably like what,
Yeah,
It-
definitely.
and yeah, and you were already a chiropractor at that point and kind of in the health space. And
hmm
so yeah, it must have been a little yeah, surprising to uncover it. And I'm just curious because I know that Hashimoto's is really like often not discovered by conventional doctors because they're not testing for the antibodies, but it seems like Graves is a little more commonly uncovered and diagnosed by conventional doctors. Is that correct, would you say?
I would agree. I mean, there's a few reasons. I mean, first of all, the symptoms are more prominent. Like when someone with Hashimoto's, if they're
Mm,
experiencing fatigue, weight gain, a lot of times they'll be dismissed, even by the person themselves. They might
mhm.
push it off. Where if someone's having elevated resting heart rate, palpitations, extreme weight loss, in some cases, not everybody has the weight loss I experienced, but they're more likely to go to a primary care doctor. And then also the TSH, like with Hashimoto's, many times the TSH is outside of the optimal range, but still within the lab range. And many
Mhm.
doctors won't say anything until it's outside of the optimal range. And patients, most people don't know any better. With Graves, very commonly it's undetectable, the TSH. So by the time like I went and got my blood test, it was non-existent. So they know something is up when they see an undetectable TSH.
Interesting. Okay. So once you got this diagnosis, what were your initial steps? What did you kind of like dive into more research or kind of go back into some training or knowledge you already had?
Yeah, good question. So again, I up until that point, I was just practicing like a regular chiropractor and not doing anything as far, definitely not focusing on thyroid conditions. And the only experience I had, as I mentioned, I would take continuing education credits. And as a chiropractor, I would almost always take nutritional courses. And there were a few functional endocrinology courses or seminars that I attended. And so I remember those trainings that I had. And because it wasn't that long ago. Prior to that, I graduated chiropractic school in 1999, and then diagnosed in 2008, with Graves. So over the years, I thankfully kept my notes and stuff and referred to them, and a lot of it was on hypothyroidism, Hashimoto's, but there was still some information on Graves, and I didn't know anybody who had Graves and restored their health naturally, but because they spoke about it and gave some of the things we'll be talking about, I'm sure, like natural symptom management options. But I guess in my mind, I knew I was going to at least take a natural treatment approach, regardless of what the doctors, what the endocrinologist specifically recommended. So yeah, I mean, I definitely did some research, but even before, once I got the diagnosis, after getting over the initial shock of having hyperthyroidism and then Graves' disease, I had already really made up my mind that I was going to take that natural approach.
Right, right. Yeah, yeah, that makes a lot of sense. So, what natural steps did you take to start kind of
Sure.
managing symptoms and then also maybe targeting the root causes if possible?
Yeah. So with conventional medicine, they typically give anti-thyroid medication such as methimazole, which a lot of people need. So again, some people definitely need to take the anti-thyroid medication. I wasn't opposed to taking it, but I figured I'd try the natural approach first as far as symptom management. So I took an herb called bugleweed, which has anti-thyroid properties, and that did a wonderful job of helping with the symptoms, and still had some palpitations. So a few weeks later, I added another herb called motherwort, which is more like a natural beta blocker. So I was taking the bugleweed and motherwort just to help manage the symptoms. They're not doing anything to address the cause of the problem, but it seemingly had the hyperthyroidism under control. And then was doing things to clean up my diet, which we could talk about more in detail if you'd like, and
Mhm.
then did some testing. Did one of the bigger tests that I did is, or at least at the time, bigger for me, is an adrenal saliva test, just because up until that point I never had done one, and did some blood testing, and I mean the saliva test showed that pretty much my adrenals were shot. I had low cortisol, low DHEA, low secretory IgA. And so, based on those findings, it made me aware that stress was a factor. I mean, I was a little bit in denial, not that I didn't think that stress wasn't an issue, but I thought I did a good job of handling the stress. But it's also important to mention, when you ask how did it start, and I was talking about how I was exercising and dieting, detoxifying, I was also overtraining when I look back, and
Mm.
that also is a stressor on the body as well as the adrenals. So I definitely scaled back as far as exercise, and started blocking out time for stress management. Of course, making sure I got sufficient sleep, and took certain supplements to help support the adrenals. Like licorice root is one of those that I took just because it extends the life of cortisol. My cortisol was low, and took like B vitamins, vitamin C, and took other supplements as well. But yeah, I mean, just diet, a lot of it diet and lifestyle. And again, based on the test results, trying to do things to help optimize adrenal, help heal the gut, and just over time, things gradually got better. I mean, there were some bumps along the road, so I can't say it was 100% smooth recovery. But overall, I was able to get to the point where, I was able to wean off the bugleweed and motherwort gradually, just because everything, as they look good, the labs look better. Eventually, I would reduce the doses and retest the antibodies as well. And so, yeah, I mean, got to the point where my thyroid numbers look good, my antibodies look good, my adrenals took some time, but they definitely look improved. I mean, the cortisol, DHEA looked better after like 3 months, but my secretory IgA was still low, so I had to work on getting that up. And the blood test, other blood test I did. So yeah, I mean, just a lot diet, lifestyle, focusing on adrenals, improving health of the gut, reducing my toxic load, just all these things. It's hard sometimes even with patients, like they'll ask like, what's the trigger? And many times it's a combination of different things. Like it's sometimes it's hard to know because we not only have different findings, multiple findings, but we are doing different things. Again, it's not just changing the diet, but improving stress and again, doing things to support the gut. So, we don't always know exactly what's the trigger, but as long as the end goal is met to get to the point where, we're avoiding the radioactive iodine and surgery that many endocrinologists are recommending and not having to rely, on medication on a long-term basis.
Yeah, yeah. It's really, yeah, it sounds like you kind of just like through everything that you knew would be supportive at it, in terms of lifestyle, uh, herbs, diet. Let's talk about diet for a minute. Like what specifically, worked for you in terms of diet?
Sure. So it's probably a good idea to mention that for many of my Graves patients these days, I recommend an autoimmune protocol, like a AIP diet. But at the time when I dealt with Graves, there was no really AIP diet. So
Mhm.
I was just following more of a paleo diet at the time. And again, overall, I was improving, but I mentioned that I hit a little bit of a roadblock. When I retested adrenals, my cortisol and DHEA greatly improved, but my secretory IgA was still low, and I wasn't sure why, but I decided to cut out nuts and seeds. And just because, again, doing some there wasn't an AIP diet per se, but there were other like gut healing diets and they would recommend like avoiding eggs and nuts and seeds, which essentially is AIP. And I wasn't really a big egg eater at the time, but I was eating nuts and seeds regularly. So I took a break for a few months. I mean, it could have been coincidence, but when I retested secretory IgA a few months later, that had normalized. So I guess you could say started out with paleo, and I still did pretty well with that, and then made the transition to kind of what they would refer to these days as like an AIP gut healing diet.
Got it. Got it. Okay. Yeah, yeah. Just a good anti-inflammatory diet.
Exactly.
Yeah, and it's interesting that you needed to kind of take the next step and cut the nuts and seeds because there's so many paleo recipes that are almond based. Everything's got like almond flour or almond milk or cashew now. A lot of that. So that's what I've found as well. Got to kind of watch that. So.
Yeah.
So the big jumps you had a jump with taking the herbs, and it sounds like you had like kind of another like jump when you were refining your diet, and then the adrenal part. Did you feel better? Notice that you felt better as your adrenals were you were addressing those, it sounds like.
Yeah, I mean, definitely from a symptom management standpoint, I felt pretty good after a few weeks of taking the herbs. Again, the
Mhm.
bugleweed I started out with, and then the motherwort, and yeah, I mean, I don't know if you could say cleaning up the diet like that. I don't. I mean, because again, I get, and it's been like a while since I did everything. So as far as the order, like when I started taking the herbs, I'm sure I was making dietary changes at the same time, but I think I'm pretty sure it was the herbs more responsible for me feeling better because that's usually will help lower the thyroid hormone levels quicker than the diet will. But again, that's where it becomes a challenge, knowing, okay, is it the herbs, is it the diet, is it the stress management? And but the stress management really didn't come until I got the adrenal results. I definitely started with the herbs, started doing things with the diet, and then it was a little after the testing results that I got for the adrenal saliva test. And then yeah, when I started doing things to improve the health of the adrenals through stress management, supplementation, just, I mean, yeah, I would say I started making a bigger leap. And then that's when very happy, of course, when I did the retest of the adrenal saliva test and saw that everything, or not everything, but the cortisol and DHEA was dramatically improved. But so I guess that was more so though a jump in the numbers itself. Like I said, I think the biggest change, because when you're hyper and you're experiencing, those symptoms, the increased heart rate, the palpitations, and I had some tremors too and increased appetite. I mean, again, the thing that most people want is relief from those symptoms. And I mean, everybody has different symptoms, but and for some, the medication, I mean, it's if they might take the medication and might have similar results, which is fine. Um, with me, again, it was the herbs, but I'd say that was the biggest change,
Mhm.
just because at that point I was getting relief from the symptoms. And
Mhm.
other than the hyper symptoms, it wasn't like I was feeling terrible. Like some people do experience fatigue and a lot of digestive symptoms like bloating and gas. I can't say I was having those specific symptoms. It was mainly the hyper symptoms for me. So, like I said, once I did things from a symptom management perspective, I felt better. Of course, I knew I still had to do things to improve my health and address the autoimmune component. But yeah, so I don't know if that answers the question. From the symptom management standpoint, that was really, I think, the biggest difference as in me feeling better. So
Right, right. Yeah,
yeah,
absolutely. And then your thyroid testing got to the point where Graves was not it was not showing Graves anymore, correct? Like
correct. Yeah, that
yeah,
is the
yeah. Yeah, yeah, awesome. So I am curious, like what, because I'm sure a lot of people who you speak with ask this, like, what does an integrative approach look like? Because maybe they do want to take the medication, but they also want to do some other things to support their health. So what does that typically look like?
Yeah, I mean, a good number of my patients take an integrative approach because a lot of people, when they see me, they have already been diagnosed with Graves and they're seeing an endocrinologist, and many of them are already on the antithyroid medication. I mean, there are some people that absolutely don't want to be on it, but to answer your question, an integrative approach an example would be someone decides to take the antithyroid medication, but they realize it's not a long-term solution, that it's not going to do anything to improve their health. It's just managing the symptoms, similar to bugleweed, but just a different way of accomplishing that. But they will do things to address the cause. So essentially, while someone is on the antithyroid medication, they will clean up their diet. They will do certain testing. I mean, again, not everybody does the same test. I do recommend adrenals for most people, but some people will need a comprehensive stool test. There's organic acids testing. There's a number of different tests. So that's why we do a health history. But yeah, essentially just combining the medication with trying to address the cause of the problem would be the integrative approach that most people who take the antithyroid medication would take.
Mhm. Got it, got it. And do you find that some, if they take an integrative approach, they maybe are taking the medication for a little while and then they're able to get off of it, or is that
Oh yeah.
sometimes the case? Yeah.
Yeah, I mean, what it's a little because with Hashimoto's, I mean, it's a little bit different. With
Mhm.
Hashimoto's, you get this damage and destruction to the thyroid. So some people, when they address the autoimmune component, they might still need to be on thyroid hormone because of the damage that takes place. With Graves, you're not really getting damage. You're getting what happens is the thyroid stimulating immunoglobulins, those antibodies associated with Graves' disease, they're stimulating or binding to the TSH receptors, but not really damaging them. So if when someone gets to the point that we address the autoimmune component, yeah, that's the goal, is to get them to the point where they really don't need the antithyroid medication. Obviously, I'm not a prescribing doctor, so I can't tell them to stop taking it. But as their health improves and they're getting regular tests, usually what happens, again, if they're on the medication, they're still seeing the endocrinologist and getting blood tests. And then as their numbers improve, the endocrinologist will gradually decrease the dose. And most of the time, the person will be able to get off the medication. There are sometimes challenges where it's difficult. I mean, I wish I could say I had 100% success rate, but some people, we struggle to find the triggers and normalize the antibodies. And, in that situation, it,
Mhm. You're muted somehow, or somehow.
you sure? Am I?
Oh, the internet connection. It says my internet connection is unstable. Hang on.
Uh-oh.
Hang on. I can edit this.
Okay.
Yeah. And I, yeah, I'm just gonna I don't know, sometimes it helps to close out tabs, other tabs I
Yeah,
have
I made
open.
sure I did did that before because I'm guilty of having like so many tabs open. So
Yeah, we'll see if that helps.
okay.
My husband's also probably on a Zoom call right now, so
Okay, no
a
worries.
lot
Can you
of
hear me okay now?
internet demands. Yeah, yeah.
Okay.
So if you don't mind, you were saying, just kind of like go back to previous thought. You said some people find that, so I don't know, maybe just like restate what you just were saying.
Yeah. So the goal, obviously the goal most people have is to get to the point where they don't need the medication. Those who decide to take the antithyroid medication while addressing the cause of the problem. As some people, if they're not able to get to the point where their antibodies are normal and as long as the antibodies are present, there's always the risk of them becoming hyper. So, I mean, then they might have to make the decision. I mean, to me, I want to do everything I can to help people avoid a radioactive iodine thyroid surgery because again, it's more of an immune system problem, Graves, and a thyroid condition. If someone needed to be on a low dose of antithyroid medication or continue taking bugleweed long term, to me, that's better than radioactive iodine thyroid surgery. Not to say there's not a time and place for surgery, because there is, but to me, there's always a cause. It's just sometimes it could be challenging. Thankfully, most people that's not the case, but just being upfront and uh, most people are able to get to the point where they don't need the medication and they walk into an endocrinologist's office. Not that they actually do this, but they could walk into an endocrinologist's office and say, I'm in remission. I'm sure some people, some people do, but uh, again, there are some people where it's a little bit of a struggle to get the antibodies normal and get them off the medication. But that is the end goal, really, with everybody who is on medication, to try to get them, again, without me actually telling them to stop the medication, but where their body doesn't need it and the prescribing doctor eventually weans them off of it.
Mhm. Right, right. Because is the expectation when you're diagnosed with Graves that you potentially may be on medication for the rest of your life to manage it, or surgery or radioactive iodine? I guess those are the different
Yeah,
courses.
yeah, those are the three options. I mean, usually most endocrinologists, there are exceptions, but most do not want the patient to be on medication long term. Like it's different. What again, Hashimoto's, that's typically the they prescribe not anti they prescribe thyroid hormone replacements, and then the person's on it lifelong. In the case of Hashimoto's, when someone goes to an endocrinologist Graves' disease with Graves' disease, most of the time, they don't want the person on longer than 18 months to 2 years. So they'll usually set a deadline that if the person's not in remission, and their definition of remission is just where their thyroid hormone levels are normal. Many times they're not even retesting antibodies. And then if the person relapses after, let's say, 2 years go by and they're at the point where maybe they can get off antithyroid medication, and then if they relapse, which is uh, quite common, then they might need then typically the next step will be to recommend radioactive iodine thyroid surgery. I mean, there are some endocrinologists who will say, well, let's just put you back on antithyroid medication. There is some research out there showing the safety of like low dose methimazole, like 2.5 or 5 milligrams long term. Again, not ideal, but to me, if someone's tolerating it well, I'd rather, if I was in that situation, I'd rather do that than get surgery or radioactive iodine. But that's just my opinion.
Right, right, right. Every case is different, and sometimes a little complex. All the different pieces, but um, yeah, I appreciate you kind of sharing. Yeah, what kind of some of the different approaches might look like. Um, how about your maintenance regimen now to, stay in remission, or maintain, be symptom free, I guess.
Yeah, so as I mentioned, I haven't taken the bugleweed, motherwort, like that was for about 9 months. I was on those. So I haven't had to rely on those for years. So now it's really just through diet and lifestyle. I followed more like a modified paleo diet, definitely not as strict as I was when I was dealing with Graves, and I can't say I never indulge and have a cauliflower crust pizza or something else. But again, try to minimize the bad foods that I eat, and stress management. Again, I do block out time for stress management. I do sauna therapy, infrared sauna. Now I can't say I did that while I was dealing with Graves' disease, so that wasn't a that can't say that played a part in restoring my health, but part of my regime now, my health regime is doing sauna 3 times a week. I go exercise, making sure I'm not overtraining. If anything, I do more resistance exercise. I do some cardio, but not like I used to do. Not so yeah, and then some supplements. I mean, I do take some supplements, omega threes, so like fish oil, probiotics, prebiotics, magnesium, vitamin D are some of the ones that I take on a consistent basis, and yeah, so I mean, a lot of it is the diet and lifestyle. And I'll say this, nobody's perfect, of course. I mean, I'm not perfect with the diet, I'm not perfect with the stress, but even when I fall off the wagon a little bit, I make sure it's not for long periods of time. So when I was, mentioning the cauliflower crust pizza or whatever I'm eating, I won't go like weeks or months where I'm just, eating things that I shouldn't be eating. Same thing with the stress. I'm now more of aware that if I get stressed out, that again, if it's every now and then, not a big deal, but trying not to let chronic stress get the best of me, trying to make sure I get sufficient sleep. So really just overall, even though I'm not perfect, overall I'm taking good care of my health, better care of my health definitely than prior to my diagnosis.
Right. Yeah, yeah, good to know. Kind of what you do to maintain your health. So, what advice would you give to others maybe recently diagnosed with Graves?
Yeah, good question. So I would definitely say that there is hope. And if you were recently diagnosed, you probably went to an endocrinologist and was diagnosed. So just keep in mind that the endocrinologist is just going to recommend what we mentioned, the medication, radioactive iodine, or thyroid surgery, but there are other solutions. If you ask them about diet, if you ask them about addressing the cause, they're in most cases they're going to dismiss it. And sometimes they'll be quite negative rather than saying there's nothing, it's not going to hurt to eat a healthy diet. Many will just say, oh no, diet's not going to help, so don't bother changing your diet. But with any, not just with Graves, but as you know, with pretty much all autoimmune conditions, chronic health conditions, uh, ch changing diet, lifestyle, improving your diet and lifestyle definitely could have a dramatic effect. So yeah, I would say the advice is, I mean, do what you need to do to manage the symptoms. You want to be safe, whether it's through the herbs or through the medication. But there's a reason why you develop Graves and why you have that autoimmune component. And while managing your symptoms, in my opinion, you want to do things to try to find and address the cause of the problem.
Hmm. Yeah, yeah, absolutely. And is there like one action that listeners can take today that maybe might help them start feeling better with Graves? Like the number one thing. I mean, diet keeps coming up. Is that the number one thing, or what would you say?
Yeah, I mean, the thing is, like I said, diet, it varies depending on the person. So
Mhm.
I would say everybody everybody can with Graves can change their diet. And I mean, that's something they can do immediately, change their diet, block out time for stress management. Now, will they see immediate changes? It depends on the person. So, I mean, I'm still going to go back to managing the symptoms. And again, maybe that's not something they could do on, I mean, sometimes they could do it on their own, like I did with the herbs. Obviously, I'm going to be biased and say, even in that case, work with a practitioner. But that's really, like I said, whether someone's, I mean, even those, obviously, those take the medication, same thing over and over again. I hear, wow, I feel so much better, because again, those elevation in thyroid hormones can lead to a lot of horrible symptoms. But yeah, so I definitely would say, so it's hard to say, do this one thing and it'll make a difference because diet usually takes time to make that difference. Same thing with stress management. So I definitely would say do it right away. If I was going to choose one, yeah, I guess I would say diet, change your diet. But again, also be safe, do whatever's necessary to manage your symptoms.
Mhm. Right, right. Yeah, that makes a lot of sense. And what's interesting, what I'm like hearing really loud and clear, because I need to hear it, is block out time for stress management. And you said that
Yeah,
a couple of times, and it's not just manage your stress, but you say block out your time for stress management. And so, and just, yeah, that is a really good reminder that it's important to like build that in, whether it's, just a calming walk or, meditating or something. Everybody's
yes,
kind of drawn to something different, but it's super
exactly.
important for sure. Yeah.
Yeah. Yeah, I was gonna say
Um,
just get in the routine of that's what I mean by blocking out time. So just like you go if you want to work out at a gym or even at home, it all is about getting into the routine. So same thing with stress management.
right. Yes, yes, exactly. I agree. Um, well, this has been so insightful. So interesting to hear your personal story. I appreciate you sharing. Let folks know where they can find more about you and the many resources that you have on endocrine challenges.
Sure. So, I mean, my main website that's been out since 2010, naturalendocrinesolutions.com. But then also I have another one that I had to create, savemythyroid.com, when I came out with the Save My Thyroid podcast. And so you could check out that website or just go to your favorite podcast platform and type in Save My Thyroid. And then I do have a few books. I have Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, which is now in its third edition. I came out with another book on hyperthyroidism, The Hyperthyroid Healing Diet, in 2024. And then I also have a book on Hashimoto's triggers. And of course, you could find all of those on Amazon as well as other places where books are sold.
Yeah, fantastic. And you're on YouTube as well, right?
Yep. I'm on
Yeah,
YouTube. Yep.
yeah. We will make sure we have all of those links in the show notes. So
Thank you.
many fantastic resources between the books, the podcast, YouTube, and more. So, yeah, you are a wealth of information. So, thank you so much, Dr. Eric, for coming on today and chatting with me. And I know people will get value out of it.
Yeah, thank you. Thank you so much, Casey. It was great having this conversation.
Likewise. Okay. Hang on.